When I first meet a patient, it's important to me that they feel comfortable. So I try to make sure I shake their hand because I think a sense of touch is very important. And I want them to feel reassured. And I want them, when they see me and I smile at them, to know you're okay. Like, we will get through this, and this will not be an overwhelming task. Having come from a large fertility center in Manhattan, I came from Columbia University. It was great because it's huge, but the downside of such a large practice is it's very impersonal. And when I looked at various fertility centers in San Diego, one of the most important factors was it had to be somewhere that was personal. It's not just a name on a chart. I actually know the patient, and it's my patient. I wanted to provide that kind of compassionate care. And San Diego Fertility Center allows me to do that. And the second thing is, I wanted to come to a center that continued to have good success rates, similar to the center I was in Manhattan. And San Diego Fertility Center definitely has very good success rates. There are many factors one must consider when choosing where to go for fertility treatment. One of those factors is the success rate of the center. The other thing to look at is the fertility center's embryology lab, to make sure that they do have embryologists, that there is a lab director, to make sure there's quality control in the embryology lab. And of course, the physician. And it's very important to have a physician who will be with you not only when things go great and you have the baby, but also when things aren't going so well. Somebody who's compassionate, somebody who can be sympathetic, somebody who will understand and take care of you medically, but also your emotional needs as well. San Diego Fertility Center, they have their own operating room called Del Mar Surgery Center. So all our surgical procedures can be done on site. But in addition to the facility, a lot of the staff here is very experienced. We have registered nurses, we have nurse practitioners, and we also have physician assistants. And they are integral to providing the patient with their ultrasounds, with other diagnostic tests. And they become so integrated in the patient's care that the patients really feel that the nurses are invested in seeing them succeed, because they are. And then of course there are the physicians who manage the patient's care. And every day we have a conference called the Patient Care Conference, where all patients that come to the office that day, we go over their chart, we go over their history, we go over their lab results as one team, which includes the embryologists. And together as one, we make sure that we optimize the patient's care.